Welcome to the Unapologetic MidLife Podcast. I'm your host, Mindi Lobuzzetta, and I am here today with Dr. Courtney, who is a pelvic rehab coach for high-performing women 30 plus to decrease pain, prolapse, leakage, and more. And if you don't know anything about pelvic floor, well, she's here to update us and tell us what we need. Welcome,
Thank you
Courtney.
so much. Thank you so much for having me. I'm excited to be here.
Thank you. We were just talking before I stumbled across your page on Instagram and I'm like, okay, I love her and I need to reach out and see if she's willing to come on and share a little bit about what it is that you do and why it's so important for women, especially us women 30 plus, to work on our pelvic floor. First of all, what is a pelvic floor?
Yeah. So great question. I love it. Pelvic floor is just a simple group of muscles that lie at the bottom of the pelvis. They're just like any other muscle group in the body. So they contract, they relax. They're just in a vulnerable space of the body that not a lot of people are aware of or talk about, right?
Mm-hmm.
Until it becomes an issue. So they're not commonly talked about like, shoulder pain and back pain and, my rotator cuff and my hip labrum. It's like one of those muscle groups that is always like, it's now an issue when you have the leakage, you have prolapse, you have the babies, or you had a pelvic surgery. And now it's like, oh, there's this group of muscles that I need to be aware of that no one has ever told me about.
Never.
So it's silly because it's one of like the biggest things that most women go through, right? It's like they have a child, they have a hysterectomy. Like it's one of the biggest reasons that women have issues is like from those things, right? And so when we are not educated in what the pelvic floor is, it can become one of those things that's like one taboo. It's hush hush. No one talks about it. It's embarrassing to talk about, but also like there's a lack of resources and a lack of knowledge around that area because it's just not widely known, even though it is. It's very apparent. When you have an issue, it's very apparent what the pelvic floor is, right? Because you're down the Google, you're down the rabbit hole and you're searching until you can find answers of what this pelvic floor, who the heck is this pelvic floor, right? Like, and where did it come from?
Yeah.
So yeah, anybody at any age can actually benefit from pelvic floor therapy. It's not necessarily like and over. That's just a group that I kind of specialize in because they're normally people that have had kids or maybe they're hitting perimenopause early, they're in menopause, or having pelvic surgeries. They're just more apparent in that age group. But I see kids with it. I see teenagers with it. I see there's tons of teenagers that struggle with leakage, for example, when they're playing their sports or their gymnastics or their runners. Like anybody can have pelvic floor dysfunction at any age of life. You don't have to have kids to have it. You don't have to be a woman to have pelvic floor issues. Believe it or not, I treat a lot of men. So yeah, it's just one of those areas of the body that is hush hush until you have a problem. Not a lot of preventative around it.
Yeah, and I feel like there should be, right? And I guess what are some of the factors that lead into why someone might have leakage, especially early on? Like what's going on with their pelvic floor, why they might be having this issue, and how does that impact us as we get older too?
Yeah, great question. I mean, there's a lot of risk factors for developing pelvic floor dysfunction, just like there are a lot of risk factors for developing shoulder tendonitis or knee pain, right? It goes hand in hand with a lot of lifestyle, poor habits. Like there's a lot of reasons and risk factors that someone can develop pelvic floor dysfunction that are independent of ever having a baby or independent of having a pelvic surgery or trauma, whether that's physical trauma, that's sexual trauma, that's an insult or an injury to the pelvis. Like there's a lot of reasons outside of those, like that can cause pelvic floor dysfunction, like using the restroom when you don't need to use the restroom, the just in case pee, right? The urgency, right? The struggling to use the restroom. Like if you are constipated all the time and you blame that on lack of fiber and in your diet and IBS, and there's a lot of reasons that can cause like bowel slow motility, that can also be a pelvic floor issue or contribute to a pelvic floor issue because you're chronically straining on the toilet. And there can be things like if you're a teacher or a nurse, we see that a lot in those populations that just don't get the opportunity to use the restroom very frequently, where they have to hold their urine for long periods of time, like upwards of like 6, 7, 8 hours where they're not having a bathroom break. That can cause a lot of pelvic floor tension, urinary retention issues, which can lead to a lot of urgency, frequency, leakage issues. So those are just kind of like habits and daily choices and maybe things that we're not aware of in our day-to-day life that could be contributing to bladder or bowel issues. But then we also see lifestyle patterns like heavy laborious jobs where they're chronically straining, chronically bearing down, not using their core, bending over with their back, not utilizing their glutes. And then we also see women who are heavy lifters, right? They're CrossFit, they're powerlifting, they're doing heavy strenuous lifting and they're holding their breath and they're bearing down into the pelvic floor. We also see women of the age, like, I mean, I grew up a millennial, so I grew up in the skinny girl, suck it in, tight yoga pants era. And like, all of us grew up sucking in our stomachs, right? And chronically gripping our glutes. And like, so there's a lot of things that we're just kind of doing day to day that can actually contribute to issues down there. And we're sitting a lot more than ever, right? We're
Yeah.
chronically bent over on our phones. We're chronically stressed. We're chronically clenching. Our pelvises are tucked under our bottoms. There's a lot of reasons. I could name 500
Wow.
of
I
them,
mean,
but yeah.
I feel like it's like the little mind blown emoji right now. All these things that we all do. I know I'm as guilty as the next person. I sit all day with my job. I know I have to be physically active, but I don't even know if I'm doing the right things in my workouts to help, right? Because there is this push to lift heavy, lift weights, especially I'm 48, right? So at this point in life, we are trying to build muscle because we're losing it and we're losing bone.
Mhm.
But how do you know if you're doing the right thing? I think a lot of people are probably doing the wrong thing, thinking they're doing the right thing.
Well, I mean, it's not that heavy lifting is bad. I definitely don't want to get that out there because I want
Okay.
every woman over 35 to be lifting heavy because of perimenopause and menopause. Like that is the goal.
Okay.
And jump training and impact training is very, very important. But
Yeah.
what I'm getting at is the how. It's not what you do, but it's how you do
Okay.
it, right?
Yes.
So it's making sure that you know what pressure mismanagement is and what good pressure management is. So
Okay.
meaning pressure management. So we're talking about a core canister here, and I'll describe what that is. For lack of visual, it's your pelvic floor is made up of inside of a core canister made up of 4 other groups of muscles. And so
Okay.
your diaphragm, your pelvic floor muscles, your deep transverse abdominis layer, abdominal wall, and
Okay.
your multifidi, which are some of your back stabilizers. And
Okay.
those 4 muscle groups make up literally like if you think of like a soda pop can, and
Wrapped
inside of
around.
that can is a pressure system, right? And so if
Okay.
you apply pressure from the top down, you're going to create a negative pressure within that system. Well, that pressure has to go somewhere, right? It's either
Right.
going to go down, or it's going to go out to the sides. And we see women all of the time, and even men, like this is just something that's normal for the population that lifts heavy, is chronically generating a lot of pressure in that abdomen that then creates a downward motion or outward motion of pressure. And you'll see women or men with weightlifting belts, for example, and they are like
Okay.
really bearing out into the abdomen, right? And they're really generating a lot of pressure there. Or you'll see women chronically kind of bear down into that lower abdominal wall. It kind of looks like a lower pooch a little bit when they're lifting heavy if
Yeah.
they're not engaging their core muscles, right?
Okay.
So we see this generation of pressure in this soda pop can. And that's not great pressure management. That's pressure mismanagement. You're not managing that pressure well, especially if your core is not activated, your pelvic floor is not fluidly moving. It's maybe stuck, it's tight, it's overactive. Or maybe you have diastasis recti from having a baby, or you were
Yeah.
born with it. You don't have to have a kid to have diastasis recti. You can be born with it.
And some
So
people might
there's
not know what that is. What is that?
diastasis recti is just when the linea alba in the middle of the abdomen has less integratous tissue and there's like a gap in between, right?
Okay. Okay. So
There's a
the
lot of definite.
muscles are separated in there for like putting it
Yeah.
simply. Okay.
Yep.
Okay.
And you can be
Okay.
born with that. Like, and there's a lot of
Okay.
women who also have babies. This is kind of off topic, but there's a lot of women who do have babies and contribute diastasis recti to having babies. But it's like, no, maybe you were just never at a low enough body percent fat to know that if you've never really had complete like a complete line, right? You've never not had it separated, right? Like it's always been together, right?
Right.
You don't
Right.
know if it's always been there or if you've always maybe had a separation, like you were born with it. And if
Yeah.
you've never gotten like a washboard abs, like low enough body percent to know that, and then you try and strive so hard postpartum to try to get back to this like diastasis closure. Well,
Mm-hmm.
maybe you had it in the first place and it never bothered you, right? And now you can't get there, and now that's a frustration point for you. But That's besides the point. That's diastasis recti.
Okay. But that's a big thing,
Yeah.
though. I've seen women post
Yeah.
about that and are like, I was wondering why I wasn't making progress because I have this.
So we'll just wrap it back up on the pressure management side. And yeah, that's what can cause a lot of issues down
Mhm.
the line. And I'm not talking like months, weeks of doing this. I'm talking years. Like
Yeah.
there's a lot of women that I will see postpartum who have chronically been lifting CrossFit or powerlifting most of their life. And now they have a baby and now they have prolapse. And they're like, oh, the baby caused prolapse. And it's like,
Yeah.
maybe, but like that's just one part of the puzzle. And you've been doing all of these other risk factors over here, like 10 of the 15, that could have potentially increased your risk even more. Had
Oh,
you not been
wow.
doing that, you might have a different story because not every woman who has a baby who did CrossFit has prolapse, right? Like everybody's story is different. And
Yeah.
that's why it comes down to managing how you lift, right? Breathing and bracing and making sure you're utilizing your core, your pelvic floor is mobile, you're breathing, you're not just holding your breath, you're not bearing down, you're not pushing out. Like there's a way to lift heavy and do it right
Mhm.
and not have the repercussions later in life.
I feel like I'm having like a moment here as you're talking. Like, I feel like every person who lifts heavy could benefit from doing some pelvic floor work to better understand how to lift heavy. Because
Mhm.
unless I think a person is working with a personal trainer, and I'm hoping some personal trainers know this, but I don't know. I'm not so sure on that. But there's definitely a right way and a wrong way to lift.
Mhm.
And part of what you do then is kind of teach these foundational things. I'm assuming you're getting to like
Exactly.
basics, right? Okay.
The bare bones of the body. Because and there's nothing wrong with this. There's nothing wrong with somebody uptaking a fitness journey and just
Of
getting
course.
started and doing what they need to do to move the needle forward in their fitness journey. Like we
Yep.
love that. And I would rather
Yes.
them do that than sit on the couch and eat potato chips all day, right?
Absolutely.
But
Yes.
there is a way forward that is optimized better, right?
Hmm.
Not right versus wrong because there's no really wrong way to exercise unless you're just going in there and hurting yourself or
Yes. Don't do
potentially
that.
injuring yourself. Like I would not want you to do that, but exercise is exercise. Like movement is medicine. I'm gonna throw that
Hmm.
out there. Okay. I'm
I
not saying that because we will have people
100%.
coming at us being like, she said, no, we're
Yeah.
not saying that. Okay. But there is good, better, best. Okay. If we're talking
Okay.
about that, then there is a difference between exercising and training.
Hmm.
Okay.
Okay.
Exercising, we're going in and we're burning Kegels and we're just moving our body and we're sweating and we're just working up a storm, which is a lot of the population. And that
Okay.
is fine.
Yep.
Right. But if we are a goal of, I want my body to look a certain way, I want my body to perform this way, I don't want to have issues, injuries, yada, 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 right?
Hmm.
Then we need to train. We need to know
Yeah.
how our hip flexors are working. We need to know how to activate our deep core. We need to get our quad muscles firing, right?
Yep.
And that comes with your body's going to look a lot different than someone that's going to the gym and exercising. That's why you see a lot of
Yeah.
women who have that skinny fat, right? And
Yep.
they're going to the gym the same amount of time and energy that you're going to the gym and you look ripped. What's the
Yeah.
difference? Oh, it's genetics. She must be on steroid, like she
Right.
must be taking
All the
peptides,
things.
like
Yeah.
all of the assumptions. And it's like, well, why can't we just assume that she's going to the gym with a plan and it's
Hmm.
personalized and it's foundational and she's using her muscles,
Hmm.
or it's genetics.
Yeah.
It's the diet. There's
Yeah.
a difference between going to the gym the same amount of time, doing the same exact things, and actually knowing how your muscles are working, mind to muscle connection, that
Hmm.
foundational layer of
Hmm.
your body, and going in and burning calories and just sweating and getting and checking the box.
Yeah.
Right.
Yeah.
So
No,
that's
I
the
want
big
the
difference that I help
training. Yeah. And I
women
think,
see. Yeah.
yeah, I think most people want the training. I just don't think, like you said, they know the difference.
Mm-hmm. Mm-hmm. And oftentimes they don't need to. Like it's not always everybody's goal to be toned and lean, and that's okay. But the women
Hmm.
that do want that, they need to understand that it's like in order to get to that level, yes, there is diet and there's nutrition, and it's how many
Hmm.
times you're bending your elbow with that fork in your mouth. But there's also a layer of component. It's like when you're going to the gym, are you really knowing how your shoulders are activating? Are you just
Hmm.
lifting the weights, right? Like, are
Yeah.
you like, okay, do I feel my lateral deltoid moving, right?
Yeah.
Am I
Yep.
breathing? Am I bracing? Do I feel my low abs contracting right now? Or am I just kind of bearing down into my lower pelvis, right? Or am I sucking in and thinking that it's my core being activated? right? Am I
Yeah.
using my glutes to do this hip thrust and this glute bridge, or am I squeezing my pelvic floor and it feels like my
Really,
glute?
and you're really getting into it. Like, what are the sensations? What core area are you, or what like, let me take core out of there. What muscle group are you utilizing as you're doing this? And there is a lot of research on muscle memory and really kind of like
Oh yeah.
putting that energy into that
Yeah.
to target
Yeah.
that said area that you're
Yeah.
focusing on.
I mean, that's why a lot of people are in pain and a lot of people are not in pain. Like people that walk around with poor posture and they walk around and they're maybe going to the gym, but they're always in pain in the gym. It's like, well, I mean, we're all walking around with poor posture and doing the same stuff in the gym too. And it's like, I don't have pain. Like,
Yeah.
there's so many ways to look at it and talk about it, but really the foundational layer is so important when it comes to pelvic floor health.
Okay.
And there's a difference between just the pelvic floor, because when we're talking about pelvic floor, it's just like literally a group of muscles.
Mm-hmm.
When we're talking about health, pelvic health, that is
Mm-hmm.
the functionality of those muscles and your
Yeah.
bladder function and your bowel function and your reproductive function and your intimacy function, right?
Yeah. Oh,
There's a lot of
yeah.
things that are down there that like literally just regarding your health and your overall how your organs are responding too.
Mm-hmm. Yeah.
It's no longer just a group of muscles. And
Mm-hmm.
so these things that I'm talking about, it's like we're setting ourselves up for success for long term,
Yeah.
not just like, what do I need to do to get rid of this leakage? Do I just do Kegels? Like, do I just focus on the pelvic
I
floor?
think it's more
Like,
complex than that, right? Like, but I think that's what people think, right? I'm just going to do Kegels and it'll get better. So
yeah,
where would you start somebody? So somebody comes to you, maybe they have, I don't know which is the easiest to kind of talk about. What would you start with, and what would that main issue that you're kind of
yeah.
seeing be?
Well, I specialize in a lot of complex issues. Like, I
Okay.
usually like to classify myself as like the third or the fourth PT that people have gone to because they've exhausted the route of like traditional kind of things of like leakage. Like I see, yes, people that come to me just for like, oh, I pee when I sneeze or
Okay.
I cough, like that's like the bare minimum.
Yep.
And that's what I tell people. I'm like, that is like the first symptom that you might see. And
Okay.
that's usually where it's like, that's like laughable kind of stuff. It's like, haha, I pee a little when I sneeze, but it's
Okay.
not all the time. It's okay. Like, and they'll like, kind of like brush it under the rug, right? It's not so bad, right? It's not that bad yet. I always
Yeah.
get that a lot, right?
Why
But
do
I'm not
why
that
do we
bad.
have to like live with that though? Also, why are we normalizing
Yeah,
women, right? Not
exactly.
you, but like women are
Yeah.
normalizing, well, I just sneeze, sneezing and peeing
Yeah,
a
and
little,
it's
like that's
funny, and
normal.
it's the way to brush it off, I feel like. It's kind of like it makes it less embarrassing. I don't know. I don't understand it, which is why still in business, right? But
Okay.
that would be like the bare minimum issue that a lot of people might see as the first sign of like pelvic floor dysfunction,
Okay.
right? Not everybody shows up with like leakage every single time they go for a walk. Not everybody has leakage when they run, right? But I usually treat a lot of prolapse. I treat a lot of like leakage, prolapse, pelvic pain, pain with intimacy, low back and hip pain. I see the combination of all of those symptoms
Okay.
usually. And that's usually in like high performers, people that are like really athletic, had multiple babies. And the combination of those symptoms is what I treat, because when
Okay.
the combination of all of those things are going on, we know the foundation is just like kind of distraught and we need
Yeah.
to rebuild from the start.
Okay.
Something as simple as like leakage with sneezing is usually just like a reactivity of your pelvic floor. How reactive is your pelvic floor to impact, right? Or pressure management, right? That's usually like
Hmm.
I can clean that up in like pretty fast, like a week. Like it's not
Okay.
like
Oh
something that
gosh.
people need to like over time, like really focus on. But when the foundation is truly broken and there's a lot of symptoms, we're talking like 5 to 7, 10 symptoms,
Hmm.
that's usually where I start be like, we're down in the bones of the the
You're in the
body and like,
trench, right?
yeah, we're trying to get them to learn to breathe again. We're learning to connect with the pelvic floor, connect with their glutes, their hip flexors, their adductors, like all of the muscles that are surrounding the pelvis is the way that I treat.
Okay.
I don't just look at the pelvic floor. In fact, I'm online. I don't even measure. I don't even
Yeah.
internal
So,
examine these women.
which I love because you're accessible to
Yes.
people everywhere, right? Like
Yes.
this is the wonderful thing about like doing therapy virtual. So how do you know they're just telling you their symptoms? And how do you know they have a prolapse? Like, have they
Yeah.
diagnosed this with like the OBGYN? Like, what does that look like?
Yeah. Well, oftentimes women self-diagnose prolapse all the time. And then it's usually they feel something, they see something, something doesn't look right. And then they'll, go to their OB or they'll go to their urogynecologist. They'll go to a specialist that usually confirms it, right?
Mhm.
Or they'll see another pelvic floor PT in person that also sees it, grades them, and is like, hey, that's what it is.
Okay.
So there's that layer. But then also like, usually it's symptoms, it's patterns. Like I've been doing this for over 6 years. And while there's people that probably have a lot more experience than I do, I have a lot of clinical experience. I've treated over
Yeah.
1,500, probably 2,000 people at this point over 6 years. Maybe
Yeah.
probably even more than that when I was in the clinic and I was seeing like 3 patients an hour for 2
Oh,
years. Like
wow. Yep.
do the math of that. Like that's a lot of people,
It is
right?
a lot.
So through all of this time, like I've developed a lot of just experience of like, what are the same women telling me over and over again?
Mm-hmm.
And what are they all struggling with? What
Mm-hmm.
patterns can I identify um, that they're doing physically, that they're
Mm-hmm.
showing up every single day, but also doing a lifestyle audit? And this goes back to the complexity of symptoms of habits. What are
Yep.
they doing day in and day out? What is their stress like? Their sleep management? How are their toileting habits? How
Mm-hmm.
do they manage their stress? Like, what does their work environment look like? How often are they sitting? There's
Mm-hmm.
so many layers to this where it's just like when you have a lot of symptoms going on, it's no longer what your pelvic floor is doing. It
Yeah.
is no longer how well you can clench my finger or not. Like, there is a lot going on. And women that realize that there are way more things going on are the women that are going to heal. They
Yeah.
realize, like, I am taking ownership of my body, my life, everything that I have been doing up until this point. I am going to have to change that in order to actually heal this body.
Well,
I cannot.
yeah. I mean, you have to have that ownership, I think, in order to get better
Yeah.
because it's the definition of insanity. Keep doing the same thing over and over again and expect different
Oh my
results. No,
god.
that does
Yeah.
not work. Like
Keep.
it's
It's
you got to
crazy.
work at it.
Crazy. You can't keep doing it YouTube, Instagram, Kegels. You can't keep doing the same thing and thinking that it's going to help if it is not personalized to you.
Yeah.
And a lot of women will download these apps and random things. And it's like, sister, you've been dealing with this for 5 years. You think this app that everybody else is doing, including the 10-year-olds and the 70-year-olds and the other 55-year-olds are going to be doing, is going to
Yeah.
heal your issues that you've been dealing with for 5 years. Meanwhile, you have no idea how to connect with your glutes. You're not breathing correctly. The list goes on. You've been
And
toileting this way. Like, it's
yeah.
crazy.
Yeah, as a therapist, I mean, so many people don't know how to breathe and where's their breath coming from? They're not engaging their diaphragm. I mean, just like, so you're just getting to the basics of
The basics and
something
then
we all do.
rebuilding from there. Yeah.
Okay. Yeah.
And the basics work just to get them to understand, hey, this is the right way. This is the way that you were doing it, and it's not conducive to the way that we want to go.
Okay.
And then once they rebuild that, and that part is not long, right?
That's easy.
That's with like
Right.
exercises and stuff and just like habitual awareness.
Mm-hmm.
But also like you build from that. And now you're strength training again. And now you're barbells and dumbbells and kettlebells. And like you're actually doing a progressive overload program that does look like traditional strength training. There's no foo-foo pelvic floor exercises. Like if we're talking about pelvic floor exercises, do a Kegel. Like women are
Yeah.
constantly searching for pelvic floor exercise. And it's like, there's nothing that just targets the pelvic floor. Like
And it's
every
funny because I've done
exercise.
that. I've looked like, oh, I could be doing this and
Me
this. And it's
too. Me
okay.
too.
Okay. So I just want to throw that out there. People are not alone.
Every exercise is a pelvic floor exercise.
Okay.
And what I mean by that is it's an opportunity to allow your pelvic floor to dynamically move.
Okay.
Because it's a muscle group like every other muscle group in the body. As
Well,
long as we can contract it and relax it
Yep.
and use your core to connect with it and
Yep.
breathe and connect with it, you're going to move your pelvic floor versus a
Okay.
pelvic floor exercise that would literally be a Kegel.
Okay. Okay. Which you can do anywhere. You don't need a program
Literally
for.
what the word says though. Like pelvic floor exercise, like that's it. Like otherwise, like there are other ways to manipulate your pelvic floor that you can do with squats and lunges and step ups and like overhead presses. Like I think people assume that, and it might be just like lack of misinformation out there, right? And
Yeah.
they're just kind of like consuming. But they assume that it has to be like small and like gentle and like slow for them to
Mhm.
connect with the pelvic floor. And that's a good starting point.
Okay.
But oftentimes, like, if you're not understanding, like, for me, for so long, I didn't understand what was wrong with my body.
Okay.
So I assumed like I needed to go and do these random things, but like realistically, like I was just, my hip flexor wasn't firing. My adductor
Okay.
was over tight, right? Like my core, my right lower abdomen, my core, like was always just like chronically like underactive. Like I had to get deep to figure out like why wasn't I connecting with certain muscle groups? And then when I cleaned those muscle groups up and I found like how to activate them better and
Mhm.
connect with them better, all my symptoms went away. And that's just because I
Wow.
started personalizing a plan versus kind of doing random things.
Yeah. It's one shoe size is not going to fit all. So say, okay, someone contacts you. I have this issue and, are you watching them exercise ever to kind of see how they're exercising? Like, how do you, okay. Okay.
Yeah. So we do virtual evaluations in our program. So we have monthly evaluations that we reevaluate every single time. We
Great.
also have 24/7 access to our team. So women are sending videos, getting feedback. So they're
Okay.
able to prop their phone up, exercise, and while they're doing exercises and communicate is the biggest thing is like, hey, when I'm
Mhm.
doing this exercise, I don't feel it here. Or hey, when I'm doing this, I feel this instead of this. What
Okay.
should I do differently? So often it's a cueing thing that they need to understand differently, or it's a mind to muscle connection. It's like, hey, try this instead, see if you feel
Mhm.
this here. But a lot of it just comes down to getting them to have their own internal feedback, like
Mhm.
and internal processing. Like when I'm hip hinging, why do I feel my hamstrings and never my glutes? It's like you need to realize and process through it. It's like, okay, if I'm feeling this, like, should I be feeling this? And instead of just completing the workout pattern because your PT told you to do it, it's
Mhm.
like, no, when I'm doing this, it's the training. It's am I feeling it in the right muscle groups or am I just doing 2 sets of 10 and getting through the reps and saying that I did it? Like
Which I
there's
think
just that
sometimes,
difference.
right, to be honest, sometimes we probably are, right? Yeah, and I think so are you saying, like, slow and steady and being more in tune with the muscles that you're supposed to be contracting and releasing, is that a big part of this to kind of make it in a
Totally.
more simpler terms, I guess?
Yeah. 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 That's
Okay.
simple.
Yeah, which I we've all been at the gym and I never want to make fun of anybody, but there's always that person who's like racing through their exercise. And, in my head, I'm like, oh my God, like they're going to hurt
I
themselves.
know.
But also, they can't be feeling the muscle groups if they're racing through it at lightning speed.
Right. Exactly. I mean, that's just exercising. Like you're literally just like moving your bones. Like your
Yeah.
joints are just moving. But like, are you like, yes, you're using muscle groups. Like, yes,
Hmm.
you are moving them because your bones don't move without contracting tendons and muscles, right? Like,
Yeah.
but are you intentionally moving them? And there's a difference between that.
Yeah. Yeah.
Yeah. And no harm, no foul. Like I said, everybody has different goals. But if
Hmm.
you are in pain, if you want your body to look a certain way, there are reasons for why you're in the gym other than just checking a box,
Hmm.
then it comes down to the how.
Yeah.
Definitely.
What are your thoughts on stretching and how does that impact pelvic floor? Is there such a thing as stretching pelvic floor muscles? Because I know that's a big thing at my age. I have to stretch because it warms things up. What does that
Yeah,
look like?
absolutely. Yeah. I mean, there's ways to lengthen and relax the pelvic floor, and that comes
Okay.
through breath work.
Okay.
Because again, back to the core canister and that soda pop, like when your diaphragm is contracting and lengthening or contracting and shortening, sorry, it's going to go down, your pelvic floor is going to drop and lengthen. So
Mm.
just by breathing, you can manipulate the pelvic floor.
Wow. So breathing and essentially is also an exercise for the
Yes.
pelvic
One of the
floor.
only one of the best targeted exercises that indirectly or directly impacts the pelvic floor.
Wow.
Because when your diaphragm is moving, it mirrors your pelvic floor. So whatever your
Okay.
diaphragm is doing in whatever space and fashion that it's going up and down, that's how your pelvic floor should be moving with it. Oftentimes you're going to get this like miscommunication, right? Is the lack of better words of just like your diaphragm is going down and your pelvic floor is still up, right? And that
Hmm.
can be tension problems, overactivity, mind to muscle connection issues. Like there's that side of things. So we need to focus on why you're not breathing correctly in order to get to the root of the pelvic floor. Versus like,
Yeah.
oh, my pelvic floor is weak and it's overactive, or it's weak and I'm having leakage and I'm going to do some Kegels. It's like, whoa, whoa, whoa. Like, do we know why your pelvic floor is overactive? Oh, it's stuck up and in because you're chronically clenching. So that's a lifestyle factor. And also, too, you're not getting deep enough breaths for your pelvic floor to even connect with your pelvic floor.
Yeah.
So, like, it goes so much deeper than just doing like an
Pelvic floor.
exercise or a
Yeah.
Kegel. Yeah.
Which is what I always thought. I mean, I know breath is connected to so much in our body, but to hear you talk about this, I mean, I'm learning this is new, but I think this is something that everybody should have access to. And breath work, I guess I think of women, right? We're carrying the invisible mental load. Not that men don't help or husbands can't help or whatever, but we are multitaskers. We've got 20 things on our agenda. We're managing the kids. We're working full time. Somewhere there's some self-care in there. I know myself, like I'm a chest breather and I have to, when I'm working with clients, I'm oftentimes working on that diaphragmatic breathing and in and out, like trying to expand while I'm working because I'm sitting there. So incorporating these things into like your everyday, this doesn't just have to be a workout, right?
Right. Yeah. So, I mean, like, you literally can take a 5 minute, 3 minute breathing break. Like, that's a lot of things that we have with our clients because we work with a lot of people that have a lot going on, that are
Yep.
moms, that have jobs, that are, running the house as well. Like, there's a lot of reasons to put in front of you of why you can't do something. Like, oh, I don't have 30 minutes. I can't do it. Can't do it. Right. Like,
I love those ones.
my God, you have a minute to
Yeah.
just lay down and shut your eyes and breathe. Like, you have a minute. Promise. If
Yeah.
you have a minute to scroll, you have a minute to breathe. Like,
Wow.
so a lot of
Yeah.
things that we give our clients are like, when you're doing the dishes, just take big, deep
Mhm.
breaths.
Mhm.
Just slow down during small moments of the day. When you're brushing
Mhm.
your teeth, right? Like, do
Mhm.
some calf raises, do some single leg balance, do some single leg like squats. Like, there's an opportunity everywhere. You just have to try to look to find it. Set yourself reminders, put sticky notes around your house. Like, do what you
Mhm.
need to do to set yourself up for success. But
Mhm.
time is not an issue.
Yeah.
If you really wanted it, you would just do it. Like,
Right.
period, right? It's
Yep.
just literally a priority, making it front of mind and doing it. And you don't need more than 2 to 5 minutes to connect with your body and recalibrate your nervous system and come back to earth.
Yeah. No, that's so important because I think foundational, you're implementing it in all the other times. And obviously, when you go into the workout, if you've been practicing this, hopefully you're able to kind of bring this into the workout. Okay, so I've been working on my breath work and focusing on breathing from my diaphragm and getting those full breaths in. Now I need to like engage that in my workout, right? So is that kind
Mhm.
of the next step beyond breath?
Exactly.
Okay.
Yeah. So just making sure that when you are exercising that you're not bearing down, you're not holding your breath. Like, allow your body to move and allow your
Mm-hmm.
breath to move with your body
Mm-hmm.
versus sucking in and holding it all together and then carrying out an exercise pattern. Like, you want to be able to just like have it all. Like,
Mm-hmm.
do both. Like, and
Yeah.
you should do both, right? But it can feel foreign if you've never done that. Like, it can feel like, am I supposed to be breathing this way? Am I doing it right? And like, you're second guessing things. Like, it can also go that way too. So just make sure that, like, I always tell people, I'm like, exhale with exertion. Like, if you're pushing, you're pulling exercise patterns, that's usually the exertional part of the movement, or a rotational pattern,
Mm-hmm.
that's usually the exertional part to exhale at the same time.
Mm-hmm.
And that generally helps people understand and remember when to breathe versus holding their breath.
Yeah, there's a lot of breath holders. It's so common. It's so common. So
Mhm.
here's a question. So perimenopause, I know people have a lot of like GI issues that could obviously be connected to hormones, but can constipation, diarrhea, can that be connected to pelvic floor as well?
Definitely. Yep. So
Wow.
chronic constipation can definitely be because it interrupts like toileting habits. It's also a lot of pressure down on the pelvic floor. So you might like be more of like a tension holding pattern. You might be
Okay.
like kind of sucking up and in a lot. And it just increases your risk too for, well, straining increases your risk for like developing prolapse over time too.
So
Not necessarily
for,
for men, but more so for women.
for women, okay. And can you tell us what prolapse is? I mean, I feel like I know what it is, but there might be somebody who's hearing this for the first time.
Yeah, pelvic organ prolapse. So it's when like one or more of the pelvic organs, like your bladder, your bowels, your uterus, collapses into the pelvic cavity. There's different grades of it, different stages of it, where it's kind of like how far it kind of goes down. Like, does it go just a little bit? Is it more at the entrance of the vaginal canal or the rectum, or is it through the vaginal canal and
Mhm.
rectum? And then normally, like we talked about earlier, like women will see it, they'll feel
Mhm.
it, and
Mhm.
that kind of helps them self-diagnose and then go get diagnosed and get confirmation of like, oh, yep, that's what it is.
And this is something that can be helped. You said there's stages. So I know I've had some women who have had surgery for this, but is this something that can be rectified through pelvic floor therapy, depending on
Yeah,
the stage?
depending on the stage, yes.
Okay.
Pelvic floor therapy has been shown through research to reverse a stage of prolapse by 1 to 2 grades over time. And then also to pelvic floor therapy is not always something that's going to completely reverse it. So I definitely do want to say that. Like it's
Mhm.
when you have prolapse, it's not one of those things that you can just like suck it back up and like it's back to it's good
Because these are
again.
your organs. I mean, it's literally your
Exactly. Like,
organs. Like your pelvic floor supports your organs, correct?
yes. And
Yes.
there's
Okay.
different types of prolapses and there's different like what prolapse and how did it prolapse, right? Was it a muscle avulsion? Was it ligamentous support that's now lax? Like, was there a torn ligament or something? Like, there's reasons for that, and that
Mhm.
also impairs your healing.
Okay.
So, pelvic floor therapy is a good way to learn how to manage the symptoms. And a lot of what I do that's completely different than a lot of other pelvic floor therapists is I just really focus a lot on total body strength. I get everything as strong as possible outside of the
Mhm.
pelvis because that lightens the load to the pelvic floor. So the pelvic floor can do its job of helps providing that support, especially if it's a ligamentous lesion or, it's not like a
Mhm.
vaginal wall collapse. Like when the walls collapse, it can look a little bit different as
Okay.
far as like healing.
Okay.
So the pelvic floor muscles, if those are always tight and overactive, which I have always found in my clinical experience. So again, just by listening to people and their patterns, I'm able to deduct they probably have pelvic floor tension too. Getting their pelvic floor mobile will allow it to get stronger.
Mhm.
If you have a tight pelvic floor, it's not mobile, it's not going to get strong, can't
Mm.
provide a lot of support. So in order to reduce the bearing or the load on the pelvic floor all the time is get the glutes strong, get the core strong, get the hip
Mhm.
flexors, everything that else is around the pelvic floor strong so those
Yep.
muscles can do their job and the pelvic floor can do its job.
Mhm.
It has mobility and it has the opportunity to get stronger. And that is going to help women with prolapse be more asymptomatic throughout the day, throughout life, be able to maybe lift again, maybe run, hold their kids, jump, play, whatever they want to be able to do because they've done the work to allow their
Mhm.
pelvic floor to do its job.
Yeah.
Something that Kegels will never teach the pelvic floor. Like the Kegels will never solve this issue. And a
Yeah.
lot of times Kegels are often given as the solution for pelvic organ prolapse as if like that's going to heal everything or it's the opposite extreme and that is surgery,
Which you don't
right?
want, right? Surgery, I feel like if you can avoid surgery, right? If it's something that can be fixed without that, I mean, I don't even know what the recovery time looks like for that, but it can't be
Not
quick.
great.
No.
Yeah, and often the outcomes are mixed.
Okay.
Sometimes it helps, sometimes it doesn't, and that's the other thing too is like surgery is there to repair ligamentous support, right? It's there to kind of put everything up back up and in, but it's not there to do the damage that was done before it
Mhm.
happened, right? Like I said
Yeah.
before, there's so many risk factors. And if you continue straining on the toilet and you continue heavy lifting and you continue holding your breath and never using your core and you strain, if you do all of the same things that got you in the situation in this first place,
Yeah, it's not gonna get better.
your surgery will fail faster because you're going to
Yeah.
do everything to make it loosen again, lack
Yep.
of better words.
Yeah, I mean, and as we get older, I mean, it's not going to get easier. Our body, as we lose estrogen, I know that's very much part of our connective tissue. And as we lose that, things get more lax. And the muscle is so, so, so important. I reiterate that. I know I do mental health therapy, but I'm very much about mind body. Like if your body is not well, you mentally are not going to be well. And it's
Totally.
very much connected.
There's just so much like mental drainage and like I call it like mental masturbation. It's like such a funny word to say. It's like there's so much in your mind all the time. And like for me, like I have so much in my mind already.
Hmm.
Like I cannot imagine my body being at the top of that list every day. Like if I had a business to run, kids to manage, a household
Mhm.
to do, like, life
Mhm.
appointments, like, things to just, like,
Yep.
keep track of, like, and then also throw my body at the top of that list and constantly negotiating with my body and what's my body gonna be able to do today, and do I feel this? Am I wearing the right color pants today? Like, there's so much mental gymnastics that people are having day in and day out fighting their body. Like,
Mhm.
imagine if we were to clear that and you were just to go get a personalized plan for your body,
Yep.
do the work for 3 to 6 months, and then
Yep.
live your life. Live your life.
Yeah. Yeah, I mean, I think about this, and I didn't in my 20s or my 30s. I definitely do things differently now, but I need longevity, and what I do today is helping me 10 years from now.
Absolutely.
And I try to drill this into my 20 and 30 somethings. Sometimes I have success, sometimes I don't. But, it's so important, and this
Right.
is a big component of it. I feel like I don't wanna even just say women, because I think there's a lot of guys out there who have incontinence and
Oh,
are
yeah.
struggling with leakage and so forth, and it's all pelvic floor. I mean, I always thought of pelvic floor of women, like, when you said that, I was like, "Oh, man, like, this is for the guys too."
Mhm. Yeah, both of them.
Yeah.
I treat them both.
Yep. No, this is fantastic. It's huge. So I'm just thinking, so you have these online programs and you have a team that you work with. So if
Mhm.
somebody reaches out, would they be necessarily working with you? Would they be working with one of your team members? What does that look like? Tell me about your program.
Yeah, so we have a one-on-one coaching program. So
Okay.
everything that we do is like we're all doctors of physical therapy. My PTs are phenomenal coaches and
Okay.
therapists.
Okay.
And so everyone that does come into our program gets a personalized protocol and one-on-one direct access with a physical therapist through a 6-month program or a 12-month program. It kind of just depends on the extent of the issue coming in.
Okay.
But across the board, like everybody, I don't really take as much patients anymore just because I have a lot of things going on and I know my bandwidth and I
Hmm.
respect that now. If you would ask me 2 years ago, I'd be like, "Yeah, sure, come on over," and
But
burn
this is
myself
why
out
you've
again.
built this team, right? To be
Exactly.
able to have more access. It's
Yes.
what you would be doing, but you have a team, right? So
Yes.
they're doing what you would be doing.
They do the exact same stuff that I do, and they're phenomenal, and they have the same levels of experience. We run case studies throughout, so, like, everybody is like I kinda oversee them all too, right? So if it's, like, anybody that is, like, really complex, then I
Hmm.
put them with one of our really chronic pain specialist kind of PTs, right?
Hmm.
Like, you're getting paired with a therapist that is going to be able to maximize your treatment interventions and
Hmm.
listen to your story and give you the best plan of care and be there for you throughout the whole duration of the program. So there's
Yeah.
not a lot of second guessing. There's not a lot of, is this right? Is this wrong? Like, it's just like you show up, you do the work, you get the results.
Hmm.
It's the best part. And the other layer is just a supportive community that we have. So we work with a lot of women. And so, like, you're in a community of women that are also in the same journey as you, which
Hmm.
can feel really alone, isolating. No one around you is doing it. And we all
Embarrassing
know
to
how.
talk about, right? Like, yeah,
Exactly, and you know
yeah.
how Facebook groups are, like, in Reddit forums, like, it's the
God,
most doomest, gloomest place in
yeah.
the world, like,
Sometimes, yes. Oh,
so I'm
yeah.
like, "Get out of those communities, come on over to this community," and I do have a private Facebook group that is, free to the community. It's a positive community
I saw that. I did join it. I was
where
like,
you can
"Okay, I need to
come
get
in
in
and
here."
share your experiences and stuff, like, it's the good side of, the internet,
Good.
and yeah, and overall, like, I love it. We love what we do. We work with women all over the world. I have clients in Australia, Italy, Germany, like, anywhere you can name it, and then I work with people all over the United States, which is also awesome to give that direct access to care. The
Mm,
only outlier is it's not insurance, so we
yep.
are out of network,
Okay.
but it's for good reason because you get quality one-on-one care that you will not find elsewhere, honestly.
And I get that. I think a lot of providers step outside the insurance realm because the insurance realm controls the medical
Everything.
field if you're a network, right?
Yeah,
So this gives you access. You're dealing with people all over the world. They get access to care. Yes, it might be out of pocket, but also I think of too, this isn't forever. This is an investment in your body and you're going to reap the
longevity.
benefits. Yeah,
Longevity. I work with women. I've worked with women, I've been doing this for almost 4 years now online, and I still talk to the women that I work with in the first year of business, and that's
that's
4
great.
years ago, and they're thriving still, no issues. They have so many
Yeah.
tools in their toolbox, and they're like, "That was the best investment I ever made for myself." That 4-month program, that 6-month program, whatever. Like, they're like, "I'm still running." Like, I still get updates from them. Like,
That's
it's so
great.
exciting. It's like,
Yeah.
they don't have to be in and out of physical therapy once a year for the rest of their life. It's like,
Mhm.
I learned so much about my body because that's the other layer is like, yeah, we tell you what to do, but we also educate you. And now you're
Mhm.
so much more aware. You have literally ears for your body now. Like, what is my body telling me? Okay, I need to go do this because overdid it on this day. And having that intuition to your own body, oh my gosh, like
Yeah.
nobody can have that. Like,
Mhm.
no doctor can figure that out. You know your body more than anybody else. And the things
Mhm.
that you do now in your 20s and your 30s and your 40s are going to pay off when you are in your 70s and 80s. Like,
Yep.
trust me,
Yep.
I have worked with 70-year-olds, 80-year-olds, 90-year-olds that are literally wearing diapers every day.
It's like, God,
I'm sorry, but my 85-year-old grandpa, like, he's thriving. My grandma, 70s, thriving, not wearing diapers.
good.
Like, you know what I mean? Like, there's just, like, things that, like, it's just a societal thing, you know? Like, we wait
We
until
don't want that. No, we
yeah,
don't wanna
like
be completely broken and
yeah,
to the point of no return before we do something. And, I know I'm gonna say this, society is like, "Oh, we don't wanna talk about, like, bodies and this and that." And I'm like, I'm not telling people they need to be a specific body size. I will never do that. But there is a difference between healthy and unhealthy, and I don't want my body to work harder. Again, longevity. If my body's working harder just to walk into my kitchen, that's a problem, and it's longevity. We need
yeah,
wellness and longevity in every body size, but
mm,
also be realistic about it.
yeah. And we also need to be okay with, like, talking about, like, that. Like,
I
"No, you're not
agree.
healthy." Like, and being honest about it because, like, so many people are out there of, like, body positivity, and it's like, if you're 300 pounds overweight, like, that's not body positivity. You're just literally accepting that as a standard, and, like, that is not the standard. Like, that is not healthy.
It's gonna
Like,
come with
w
other things, and I
yeah,
guess, like, that and I come from a family who struggled with weight. I've always
yeah.
been, like, a thinner person. I say that not to brag, but just and then I hit midlife, and I'm like, "Oh, shit." Like,
Oh, right,
I
yeah,
I need to work out. I have to be consistent with my weightlifting and my walks
yeah,
and doing all these things because it didn't come like it did all those years, and it was like a giant slap in the face.
mhm,
But I'm willing to work at it. And here's the thing, it's not easy. It's not gonna be easy. But if you want it, it will be worth it.
mhm, yeah, and it's not supposed to be easy, like you
No,
said.
it's not. It's
If it
not.
was, we would all be lean green beans out there. Like, we would all be looking hot. Like, we would all be, like, snapping necks, but, like,
Right.
not the reality, and that's why the 1% exists, and those are the 1% that I wanna work with, that you would probably wanna work with because they're good clients and they want it, and those are the people that make our jobs so much better and so much more fulfilling.
And my hope is that it inspires people to wanna
Yeah,
be healthier. I
yeah,
think this is
absolutely.
accessible for everybody. It's not saying that, "Oh, you need to be 120 pounds." That's not what I'm saying. If you're, 5'11", you're not gonna ever be 120 pounds in a healthy way. Like, that's not what it is.
Mhm,
But it is about kinda throwing the scale away. It is about building muscle. It is about being leaner as best you can. And I mean, there's so many other layers to this with food and all kinds of other things. But I feel like we're starting to turn a corner um, in a world where, you were rejected if you did talk about fitness and wellness. But I think there's a corner where people are kind of coming around, but like, hey, I'm 30 and I can't walk a half a mile because my knees are so bad, or because my feet are so bad, or because now I have lymphedema in my legs because I wasn't walking and I sit all day. Like, people are starting to recognize that
yeah,
this is not quality of life.
mhm,
That is, you're headed to hell on earth if you don't take care of yourself. And
mhm,
as somebody who's had cancer twice, I feel like I have the ability to say that because I didn't take care of myself. I ate like crap. I
100%.
drank. I did things I shouldn't have done. Younger in my years, and at this point in time, I am like anal about my sleep. I barely drink alcohol. I try to eat nutritious food, and I work out. And those are foundational things.
Yeah,
We
yeah.
all we all have access to that.
Yeah, 100%, and that's the proactivity that, like, you and I speak about is, like, being proactive about it all because so much of healthcare is reactive care, and that's what it is, it's sick care, it's not
Yep.
healthcare, and you and myself and other people out there are more of healthcare, and that is do this now for later because
Yep.
it's expensive.
Oh my God.
And it is expensive in cost, like per dollar, because one, the dollar is going down,
Yeah,
first of all.
it is.
Second, it's cost and time,
Mm-hmm.
energy, memories. Like
Mm.
most people put a dollar amount to their health. They're like, well, I can only put this dollar sign to my health. And it's like, we're having a different conversation now. Like, we're not
Yeah,
having the same conversation. And the
yeah,
conversation needs to be like, you got to think of your health of everything about like every time that you don't get to go to the park with your kids because your knees hurt. That's a
yep,
memory.
yep,
That's time. That's
yep,
energy gone. That's money for me
yep.
at least. And I mean,
Yeah, no,
it's just a
I
different
have
conversation, you know, like
10
there's
and
so many
12-year-old
layers.
boys. I get it. Like I want to be around and I want to be healthy and I don't want to do things that I'm not saying what I did like created my sickness, but in a way it might have. I don't know. I want to do whatever I can what's in my control to prevent those things. And it's so important.
Yeah. I love this conversation. I can go on and on and on about it.
Well, maybe we'll just have to do this again.
I know, right?
So, what would be, as we're tying up, what would be your takeaway for clients who are curious about pelvic floor and are interested in learning more, possibly starting this journey?
Yeah. I think a lot of what I shared in this podcast like points it to it. And it's just understanding like what the pelvic floor is, what it does, what its function is, and understanding when it doesn't have its function, right? Like when
Hmm.
we lose mobility of the pelvic floor, when we lose the strength of it, we lose the ability to connect with it, there are consequences to that, just like anything else in life. If you
Hmm.
ignore something, there's consequences, right?
Yep.
And I think just becoming aware, knowing
Okay.
what it is, what it does, how to connect with it, because then you can always get ahead of issues versus being the person where it's just like, well, I'll wait until that time comes or I'll
Don't
wait for
worry
that thing
about
to
it when it
happen. Yeah.
happens. Yeah.
It's not
Yeah.
that bad, right? And if you do have symptoms right now, it is that bad. Yeah, because it is bad because it always trickles into something else. An
Hmm.
ache normally turns into a pain. A
Hmm.
pain normally turns into chronic pain. Like
Hmm.
that's the issue that a lot of women just need to like become aware of is like this is an issue right now. It's not
Hmm.
something to be laughed about. It's not something to be brushed off because it does become an issue later that will cost you time,
Yep.
cost you a lot more money, and cost you a lot more time or energy and mental space as well, right?
Oh God. Yeah.
So the biggest thing is like awareness. I would say get educated and know how to do things properly, right? Train, don't exercise. Like literally go in with intention when you are in the gym. And not every day is going to be like that. Trust me, I walk in some days and I'm like, I just need to get through it. But you know what? Like there are other days where I walk in there and I'm like determined and I'm ready and I want to be hot and I want to look good. Like I want my
Yeah.
body to look a certain way. I want it to feel a certain way
Yep.
because that's the
Yep.
standard that I hold. And so that's another layer. It's just like there's so many ways we can go about this, but I think the biggest thing is just becoming preventative
Hmm.
and knowing what you do now will help you 10 years from now, 30 years from now,
Yep.
and beyond.
Yep. Yes. Oh my God. Well, thank you so much, Dr. Courtney, for coming and sharing your wealth of knowledge in this area. I mean, you know so much about this, and I think this was an amazing episode, and I think people will definitely benefit from it. So thank you for your time. Thank you for coming. I greatly appreciate you.
Of course. Thank you so much for having me. This is awesome. I'm a big yapper, so
It's
anytime.
okay. I love it. The Unapologetic MidLife Podcast is for educational and informational purposes only and is not intended as medical, mental health, or professional advice. Listening to this podcast does not create a therapeutic relationship with Mindi Lobuzzetta, LMHC. Always consult with a qualified healthcare or mental health professional. And if you are experiencing a crisis, call 911 or dial or text 988 for the suicide prevention hotline. As always, please don't forget to hit that subscribe button and give us a follow and rate us and review the podcast. Thank you.